2024 is a big year for Medicare. This is Managing Your Medicare from Affordable Medicare Solutions. This presentation is for educational purposes only. I am not employed by Medicare, and I do this as a public service. Complete information is available at the federal website, medicare.gov. Never go to medicare.org or medicare.com. Those are websites that will trick you. Only go to medicare.gov, the official Medicare website. No plan names or companies or prices are going to be shared today, as this is an educational class. And we also have flyers and other information available at our website, at our YouTube channel, and on our social media, such as Facebook and Instagram. We constantly put updated information out weekly. So today's topics: who is AMS? That's Affordable Medicare Solutions. What is Medicare modernization? When can you manage your Medicare? The management periods. How do you use your official Medicare.gov account? Why do you want to do annual reviews? What's going on with prescription drugs? What is the timeline that the government has set up? And then what are the other resources and next steps that you need to take to protect yourself and your spouse? So who is AMS? Affordable Medicare Solutions has been around 29 years. We're getting ready in a month or so to be at 30 years of service, and we're a dedicated team of 10 professionals. We pioneered the educational approach here in Georgia to helping seniors and helping people with Medicare, including family members who are taking care of their parents. We represent the client, not the insurance companies. That's true. And all of our services are free. People get very confused and say, how do you have a free service? Well, the system pays us. We get paid through the system and with no bias. We are paid by the plans that our clients choose, so it's not any difference between the plans. Our agency serves all of Georgia and is the most award-winning Medicare agency by far in Georgia. So let's talk about Medicare is not something that is static. It is something that is not set it and forget it. So a big mistake would be to not manage your Medicare. The insurance companies like that when you camp out on the plan and don't actually do your comparisons and making sure you're in the right plan. It can really affect your health also. So it's not just a financial thing, it's a health decision. And you can manage your Medicare every year for changes that occur. This is a big year for changes. We'll talk about a lot about that today. And there's also help for people who have become low income or people who have developed chronic illnesses. You might be a multimillionaire, but if you have diabetes or cardiovascular disease, there are special programs for you. Yearly changes that can affect you is your out-of-pocket spending, such as deductibles and drug costs, but also which doctors you can see and what pharmacies you can use. We're seeing a lot of changes. You may have heard some of the big insurance companies having battles with Piedmont Hospital System, Northside Hospital System, Wellstar System. All the time they're having their negotiations, and sometimes they get a little bit ugly and it can affect what providers you can use. But the pharmacies are also changing. Got to be careful there too. So let's talk in general about the different types of Medicare that are available. And we have an entire class that really highlights this, and I have some short videos also on this subject. But it is the most confusing part of Medicare is, why does Medicare have two different primary channels for you to subscribe to? You can either subscribe to the traditional classic Medicare channel. Half of our clients do that. They love it. Or the new modernized channel of Medicare, where half of our clients use new plans and they love those too. It's really a personal choice. And there's a lot of debate online and a lot of false information and politicians getting involved in things. So just ask us questions, and I'll take questions in this class if you'd like to take questions at the end when we get to the end, or you can put it in the chat box, and hopefully I'll see the question and can interrupt the class and answer your question. So let's talk about your initial enrollment period to even before you get to decide which channel of Medicare you use. The initial enrollment period is surrounding your month of your birthday. So it's 3 months before your birthday month, 3 months after your birthday month, and also your birthday month. So you have 7 months total to sign up for Medicare, unless you have some exceptions, like maybe you're still working at a job, something else that has an exception to that rule. But for most people, it's around the time that they're turning 65. So let's talk about the traditional channel of Medicare. When this was invented in the 1960s, people started complaining that it didn't cover everything. So insurance companies created little plans called Medicare supplements, which became nicknamed Medigap plans to fill in the gaps of Medicare. And those plans became very, very popular. And then the government standardized them in the 1980s. And so very effective and very simple coverage. This is called traditional Medicare, and you generally have no pre-existing conditions. Let's say you're coming off of your group health plan, you have other coverage, you go into your Medicare plans, there's going to be no pre-existing conditions, and you'll be guaranteed issue at your 65th birthday when you're starting your Medicare or when you're leaving and retiring from your work. Then you'll have a guaranteed moment of picking up a Medigap plan. There are other times that they're guaranteed to you, and that means that you do not have to answer health questions. On these Medigap plans, you'll have low or potentially no deductibles, for example, no deductible at the hospital. And you'll also need to pair a traditional Medicare plan with a drug plan. Drug coverage is separate under Medicare using traditional Medicare. Veterans, for example, that have VA coverage might opt out of getting a Medicare drug plan because maybe they're getting their drugs through the VA. That's why it's separated. But you can also move your Medigap plan at any time during the year, not your prescription drug plan, but your Medigap coverage. You could change. If you get a rate increase in March, you could change April 1 to a new plan. So they do fall outside of the normal annual enrollment periods under the other Medicare plans. But you might have to answer health questions. That's called underwriting to see if you qualify if you don't have a guaranteed issue right at that moment. Now, the traditional side of Medicare is very, very popular, and we're going to talk about the differences in the next slide. But right now, let's talk about modernized Medicare. Those are called Medicare Advantage plans, and they're modernized because they are more similar related to what people have had at their current jobs. When they leave their jobs, they're very, very similar. They use networks like HMO, which means mandatory network, or PPO, which means an optional preferred network you can go to or go outside the network. And these plans also offer all the extra benefits. It's kind of an imbalance right now that only these new plans give extra benefits like dental, vision, transportation benefits, hearing aid coverage, meals, and over-the-counter items. Well, those extra benefits can change year by year. They're not mandated by Medicare, and we're going to be seeing a lot of changes in 2025 under those extra benefits. There's also no pre-existing conditions ever on the Medicare Advantage plans. There are no health questions. They don't ask about tobacco. They don't ask about height and weight. They don't ask whether or not you're a diabetic or have kidney failure or have cancer. There's no health questions, no underwriting. But you can only move during certain times of the year, special times. Maybe when you're moving, or maybe at the end of the year, or at the first of the year. I'll show you some examples in an upcoming slide. So here's the big 3 things that you need to worry about and really concern yourself about when you compare Medicare supplements versus Medicare Advantage plans. The first column says you can go to any doctor who accepts Medicare nationally. That's with traditional Medicare. So the top line, you can go to any doctor who accepts Medicare nationally that is willing to see you. Not every doctor is taking new Medicare patients. Under the Advantage plans, you would use a network of doctors. And if you use an HMO, you must use the network unless it's an emergency. But under a PPO, an open network, you can access any doctor, Medicare doctor nationwide that's willing to see you, either in or out of the network. Now, under the Medicare supplements, they are more expensive because you have to pay a premium. It is an insurance policy. It might cost you $150 or maybe $250 per month that you send off every month to an insurance company. And you might have another $20 to $50 per month for a prescription drug plan. So now you're looking at maybe $2,000 to $3,000 per year per person for that coverage. Under the Advantage system, the plans generally have no premium, which is great. But people say, well, how can I have a good plan with zero premium? Nothing is free. The government is funding these Advantage plans at about $1,400 per month per person. So the government's funding it, and the plan generally says, hey, we don't need any monthly premium. Some of the plans next year we're seeing will have some premiums, but very low and very affordable. Now, under the Medicare supplement, this is what people love, is that they have 100% medical coverage generally. You go to the hospital, you have cancer treatments, you have rehabilitation treatments, and you're not getting any bills afterwards because you prepaid for all of your care. It's not free care, but you prepaid for it. Maybe over the last 10 years, you sent in $25,000 to the insurance company, and they're required to pick up your bills when you get sick. Well, under the Advantage plans, that's not the way it works. Under the Advantage plans, you'll pay as you need care, but you won't pay deductibles. You'll pay copays. Copays mean, all right, I've had a heart stent put in. What's it going to cost in a copay? Maybe $300. It might be a $50,000 surgery, but you might only pay $300 for that surgery. Well, I need to go to the emergency room. The emergency room is a $10,000 bill. Nope. You might only pay $100, maybe $120 copay for that emergency room visit. Now, that's way better than the plans I have for myself. I wish I could have either a Medicare supplement or a Medicare Advantage plan, because under my personal coverage, I have an $8,000 deductible and $870 a month premium. So I'm paying $10,000 a year. And if I get sick, I got another $8,000 I have to pay. I hate my coverage. I would much rather have these Medicare plans. So if you look at it in the most simple way possible, when you do a Medicare supplement, you're prepaying for your medical care. And when you do an Advantage plan, you're paying when you need care. So there's no such thing as a free lunch. Pay now or pay later. So here's the enrollment periods on when you'll manage these Medicare events. Well, the initial period is what we had talked about before. That's your 3 months before and after your 65th birthday month. And you can enroll in Medicare unless you don't need to. If you're working at a large employer, 20 or more employees, you might say, I don't need my Medicare right now. And that would become a special election when you lose your employer coverage by retiring or opting out of your employer coverage. Maybe you're 70 and you want to keep on working, but you're opting out of the employer coverage. That would be a special election period to activate your Medicare. There's lots of special election periods. Sometimes it's people that are already in Medicare that are moving. They're moving from Atlanta to Hiawassee, Georgia, or to California or someplace. Well, that's a special event, that move. There's also lots of special events that happen all the time. Hurricane Debbie has been one recently. We had special rules for times when we've had hurricanes, snowstorms, floods, peaceful protests. There's been ways that I can manage people's Medicare for all sorts of reasons every year. And COVID was a great example. We could manage people's Medicare pretty much all year long during the COVID pandemic. Now, what's coming up recently, very quickly here, will be the annual election period. That's what we're preparing for right now. So it happens actually on October 15th and ends on December 7th. And why do they choose December 7th? Because they want to be able to process your application, mail you a new ID card so you can start using it January 1st. So December 7th is the cutoff. That's an interesting date. But the preview period actually starts October 1st, where we can see and discuss the new 2025 plans, but we can't actually enroll people until October 15th. Very important. Now, a new period we're going to talk about in depth is the Advantage election period. This started under President Trump, and President Biden agreed to continue it. That is a chance for people who did fail to do their reviews and changes in the annual period. If they're under a Medicare HMO or PPO, they can make changes in the first quarter of the year. So I'm going to show you in the next slide what that means. Also, special needs plans such as low income or chronic illness plans have a lot more flexibility also. So if somebody becomes low income in the middle of the year, I can get them a new coverage or improved coverage. So the Medicare Advantage open enrollment period, this is the new period that was created. And this was a rescue attempt for people who failed to do their annual review. And they go to the doctor in January and find out their doctor or their hospital or their pharmacy or their drug is not on their plan for 2025. Oh no, I'm stuck on the wrong plan. Well, now they're not. They have January, February, and March to raise their hand and say, I need a new plan. And we do that for them. We move them to a new option that's got all their doctors, their drugs, and their coverage they need, and everything's fine. It might not be fine for 1 month, but that's because they failed to do their annual review to be proactive. This is a reactive way to save their situation for the next year. Now, if you did do any sort of changes at all during the annual period, you can't use this new rescue period. But also people will opt out. They'll say, I don't want my Medicare Advantage plan anymore. I want to go to traditional Medicare. I want to get a new drug plan. That is allowed also during January, February, March. But it does not apply to RX only plans. So if somebody's on traditional Medicare with a drug plan and they find out in January that their drug's not covered, they are in trouble. So we're hoping someday that they'll fix that rule to also apply to RX plans, or maybe even this year give us a special dispensation, because there's going to be a lot of confusion this year under the drug coverage, and I'm going to cover that in an upcoming slide. So what you want to do if you are in Medicare or you're getting ready to be in Medicare and you get your red, white, and blue Medicare card, you want to go to medicare.gov and create your own personal online account. Your spouse will have a personal account. You'll have a separate account. Your mom will have a separate account. It's never a family account, okay? And you'll be able to manage your account information, print temporary replacement cards, see in-force status, research and select updated Medicare plans for the upcoming year, such as drug plans. It's very important. And so what you do is you go to medicare.gov, be very careful, use the federal official government site. You'll create your account. You'll put in your email address and create a password just by clicking create account. It's very simple. And then once you're in there, you can even view your claims. If you're under traditional Medicare, you can see, hey, I've gotten a bill from an ambulance service that said Medicare didn't pay them. Well, you can go in there and actually look in your online account to see if that's true. Maybe it's true that Medicare didn't pay them, or maybe Medicare was never even billed by the ambulance service. Then you can call the ambulance service and say, hey, wait a minute, you guys didn't even bill Medicare. And they can say, well, we didn't know that this 85-year-old person had Medicare, so we just said Medicare didn't cover it. I mean, I've heard the craziest things said over the years. So don't trust them. Verify that your claims were either submitted, pended, or paid, or denied by looking in View My Claims under your Medicare account. You can also pay your premium if you need to. You can manage your account information. You can print temporary cards, but you can also print out a drug list. This is pretty cool. You can print out your exact drug list so that if you're going on a trip, you're going into treatments, you need to show a new doctor your drug list, you can print it off right here on your Medicare account. So why do annual reviews matter? Well, we've already covered a couple things. You don't want to find out that your doctor or your drug's not covered, right? That is really primary importance, and your doctor and hospital, of course, too. But you want to make sure that you're not being overcharged. Part of the review is to say, wait a minute, you know, my friend is paying $150 a month for their Medicare supplement. I'm being charged $250. Maybe I'm getting ripped off. And that's true. Very often it's true, because it's very mostly common that people don't know that they should shop their Medicare supplement rates. In certain states, it's really easy. In other states like Georgia, it can be a little bit more of a process. But man, we save people a lot of money by shopping for a new rate, especially under the drug plans this year. You do need to shop for a new drug plan. Some drug plans are going away. They are migrating some people to new options. and it might not be the same price. And you might easily be able to find a lower price plan by using your Medicare.gov account. You also need to be advised on the new Medicare rules. Every year we get new rules and new things that happen, but the Inflation Reduction Act, President Biden's big, almost $2 trillion bill, has a lot of Medicare stuff in there that really has caused a lot of disruption. And the government's been scrambling to kind of fix some of these disruptions before the election because they didn't want seniors upset. So, man, we're getting new rules and new things hitting us almost every day to get prepped for the annual period. And they don't want to have any angry seniors going to the ballot boxes. I know that. You also need to tell your Medicare agent or advisor about any upcoming life events. Tell them that you're going to move to your beach house. Tell them if you've got a new cancer diagnosis or that you've developed Crohn's disease. That kind of information means that you might be seeing new doctors. You might be using new drugs. You need to have that conversation if you're comfortable with doing that. It's very important. So what's happened under the Inflation Reduction Act, one of the many things, is a huge protection for seniors. It's a new $2,000 cap on your personal drug cost. Doesn't mean you can only spend $2,000 on drugs. It means your portion of $1 million drug bill would be $2,000. It's $8,000 this year. So that's a huge improvement. Interesting how they had that improvement kick in right here at the election year. Insulin price caps. President Trump started this process of a $35 monthly price cap, but on his initial test, they didn't fix everything. For example, people that used insulin with a pump on their waistband, you wear a little pump, was excluded under the first round of testing on this program. Well, President Biden loved Trump's diabetic insulin savings program and expanded it to include all types of insulin. So now everybody under Medicare shouldn't pay more than $35 a month, but actually some Medicare people we have are paying $12 or less per month for their insulin. This is an enormous change, even as better than the $2,000 change, because I had seniors spending $400 or $500 a month just on insulin, regardless of their other drugs, just on insulin. And this has been a huge thing that the last two administrations have done for diabetics. So here's the timeline of the Inflation Reduction Act. We first started some of the things in July of 2023. 2024, we've had some more improvements, especially for low-income people and diabetics. But 2025 is the big one. The $2,000 out-of-pocket annual cost cap in Part D, which is the drug program. But 2026 through 2029, they're going to negotiate 60 drugs that represent about $55 billion of Medicare's current spending. And they're trying to get the cost down closer to what other modern countries are paying, like Australia, Sweden, France, Italy. They pay a lot less than we do for very expensive drugs that we have here. But a good example is there's a drug called Eliquis. It's a blood thinner. If you have a heart stent put in or have a stroke, they're going to put you on Eliquis to prevent those problems and mitigate it. It's $500 a month here in the United States, but in Canada, for a brand name version of that drug, not a generic, it's $50 a month. That's a 90% difference. It's 10 times more expensive here. So that's crazy, and they're trying to fix that. The first go around, they fixed it a little bit, but I saw an article today from The Guardian that shows how we're still paying 2 or 3 times even after this negotiation happened. So we still got some room to get better prices for the drugs, but at least it's a start. They've also put in a provision to keep the Part D plans from jacking up people's premiums, so that if one year your premium was $20 a month, it can't be $100 a month the next year. They have put in some protections for consumers, and they put in some further protections recently that was even outside of the Inflation Reduction Act, and spent another $15 billion without congressional approval on helping seniors. So the next thing here, are all Medicare agents the same? Remember, most people in this business are what are called set it and forget it salespeople. Another nickname they've received are mushroom agents. They just sort of pop up in October and November, and you got all these Medicare people, and then they magically disappear in December because they just do it part-time. They just enroll some people, make some side cash, and they're not true Medicare managers and Medicare advisors. So be very careful. Only a small percentage of Medicare professionals, there's just a handful of us here in Georgia that really are truly great at annual management and year-round service, included at no charge. So you want to make sure you use a Medicare advisor or professional service that will show you all the options and not just a select few they like, and that they're not afraid to recommend Medicare.gov, G-O-V to you, for choosing your drug plan. There is going to be a lot of drug plans that are not available through agents this year, but only available on the Medicare website. Very important. Don't shortchange yourself. And make sure that you never get a charge. If somebody says they'll do your Medicare review for $100, that's against the rules. Also, what's against the rules is illegal solicitation. Man, seniors are getting hammered with robocalls, door knocking, robo-texting. Well, these electronic communications are not monitored by Medicare. That's the FCC, the Federal Communications Commission. So don't call 1-800-MEDICARE and complain. Call 888-382-1222. And also make sure you go on and register your number at donotcall.gov. This is not going to stop everything, but I can just tell you, don't waste your breath calling Medicare about it. They will put your complaint in file 13 because that's not under their purview. Let's get to the next one. There we go. So I can go back here. All right. So let's talk about our website. This is something you can use at your leisure. Let's say you're going on a trip and you need travel insurance. That's available at our website. Dental and vision coverage, health insurance for people under age 65, and Medicare plans. They're all available, and all of the educational flyers on all the different subject matter, like how to create a Medicare account, how to do your own personal drug review. All sorts of tips and tricks are available at our website. But even better is our YouTube channel, Affordable Medicare Solutions at YouTube. You just put that in and you'll find us. We have these presentations. We have all sorts of things such as high income and Medicare videos, what happens to your Medicare during a move, how to manage it, all sorts of videos and helpful things that we've done since COVID started. Our YouTube channel was a blessing of COVID. We couldn't see people, so we started recording our classes, and it's really been very successful. So if you do use a professional service like Affordable Medicare Solutions, which I recommend you do, we will help resolve problems with prior authorizations. We will work on your behalf, assisting clients with drug exceptions and appeals. We'll give you advice on how to work with your doctor and your pharmacist. We'll help prevent scams. We'll help you review your annual notice of change, which comes out here in September. You'll get those. Don't put those in the trash. You need to read your annual notice of change, especially this year. And then you may need to shop your plan when you wish to make a change. So if you wish to make a change, you can shop your plan and it'll be effective on January 1st. We also help your adult children. If you have a child that is helping you, we love to meet them and to help them to understand the process. And they're very excited to know that we do this for no charge and in an unbiased method. We can also explain plans and benefits to doctors' offices. It's unbelievable sometimes. They don't even know how Medicare's preventive care rules work, how all sorts of features under Medicare work, and we have to actually educate provider office staff commonly. A big one, though, is all of the free extras that people get. There's almost too many, like dental, vision, hearing aids, groceries, transportation. It's a lot. Gym memberships, new eyewear, etc. So we help people navigate their plan, extra benefits, and make sure they get the most out of their plan. We do ongoing education and updates by email plus social media. I'm filming a video today that I'm getting ready to blast out by email to our clients to help them prepare for the changes in Medicare. We actually help clients when there is disruption to provider networks, when doctors and hospitals are impacted by negotiations. We do help mitigate that and help iron out any problems. And we do this on a year-round basis. We have 10 employees, a full client service team to take care of our clients year-round. So our name is Affordable Medicare Solutions. Kevin Meaders and I have known each other since college. He's a great guy, built a great practice. I know you trust and love him and his staff. I'm always impressed at their white glove service that they have, and I've tried to emulate that at my practice to make sure we have that same level of white glove service. And you can reach us in multiple ways. You can email us, you can call us, you can go to our website, contact us through social media. Whatever you're comfortable with, we'll take care of you.